Hey guys, hello, hello, hello. Happy MLK Day. Do me a favor, come in, guys. Let me know where you are watching from. Come in and let me know. Good evening, good afternoon, good morning, depending on where you are. Hello, hello, hello. As you come in, let me know where you're watching from. Let me see. Let me go over here. I did not enable this. Let's see. Content. I may have to go out and come back in. Let me see. Can I turn this on from here? Okay, yeah, here we go. Okay, come on in, guys, and let me know where you're watching from. Let me go ahead and go live on Instagram. Hey, Talita, I'm happy to see you too. Hey, Ashley. Hey, Karima. Hey, Stacy, Alondra, Tanya, Alabama. Okay, good to see you guys. Hey, Lexi, AA. Congratulations, AA. Guys, come on in. I'm just trying to do something on my phone really quickly. Let me see. Let me turn this down here. Let me go out and come back in. Just go ahead and let me know where you guys are watching from while I'm trying to get settled here. On here. All right, let me switch accounts. Hopefully it's on here. All right, let me put in the comments here too. My MA refresher course is on sale, guys, for today. So I wanted to let you guys know that. Even while I'm doing that, let me come here. Oh, here we go. Oh, man, let's see. Okay, let me pin this. I'm not coming on camera today, guys. I am not camera ready. How do I pin this? Why isn't it letting me pin this? Sorry, guys. I'm trying to pin this comment here on my YouTube. Let's see. Okay. All right. Let me go back here. To the comments. Oh, you taking it on 31st? Okay, Ashley. Hey, Paris. Hey, Honest. Send me Talita. Send me a send the email. It's the same email that you got from when you signed up. It's Kendra at it's a couple different ones. It may be Kendra at MA. What is it? Kendra at MAwithMissK.com or Kendra at medical at MArefreshercourse.com. But either way, send me an email. Just you can respond back to the email that you got when you signed up. But it's Kendra at MAwithMissK.com or Kendra at MArefreshercourse.com. Let me see if anybody's on Instagram. Hey, Instagram. Hey, Anna. I'm glad you off today. No limit. Okay, no limit, Jalea. Says I found you on YouTube or your videos have been extremely. Thank you. I'm so glad to know. Hey, Jasmine. So, guys, I wanted to let you guys know that my refresher course is on sale today, and I'm going to just kind of give you guys a little preview. So, I'll do a preview and just kind of some review in one. I have been getting so many messages, emails, comments like, when are you going to go live again and do some study sessions again? I don't have I haven't had time to like create something, you know how I would normally do the slides and stuff. But I said, since I'm doing this sale, let me go ahead and go live again and just kind of give you guys just a little preview. So we're gonna go through some questions together. So for those of you that don't know, I do have an MA refresher course. The link is actually posted. Matter of fact, I didn't even post the link on Instagram. Let me make sure I post the link on Instagram. So if anybody's watching on Instagram, I just posted the link and let me go ahead and pin it. So for today until 9.90 until 11:59 p.m. tonight, it is $9.99 for 30-day access. If you want the 3-month access, that's $27. If you want the 6 months access, it's $80. And no matter which access you get, there are payment plans available. So let's just say you're like, I need the 6-month access, but I don't have $80 right now. You can simply just do the payment plan. I wanted to make sure I made it affordable for everybody. Everybody's saying congratulations to everybody that passed. Everybody that passed, congratulations. You know what? I wanted to shout out. Oh man, I can't even think of her name, but there was a young lady who told me I can shout her out. She passed so many certifications. I should have had it pulled up before I went live, but she passed so many certifications. She wanted me to shout her out the next time I went live. So if I can't do it today, I will just make sure I do it. I'll just make sure I do it when I go live again. So I just want to show this here. It's $9.99 until tonight, but I'm gonna just put this banner up and just keep that there while we go through some study, few questions. Let me see if you guys have any questions in the comments. Congratulations to everybody who passed again, and good luck to everybody that's about to take your test. Guys, some of you have my MA refresher course. Do me a favor, for those of you that's watching now and you have it, especially those who already passed your test, do me a favor and make sure you send me a review. If you could do a video review, that would be helpful. If you could just do a quick 10-second or 30-second review, that would be even better. Let me know how the course has been for you guys. Family time, congratulations. Tiffany, congratulations. All right, I'm loving it. Stacy said, congratulations to y'all. I'm next. You better claim it, Stacy. You better claim it. She said, I am next. I know that's right. Let me look on Instagram. Let me see real quick. Anna C says, yes. Okay, let's go through some. I'm going to give you guys a little preview. Let's go through some of these questions together. So y'all know how I do. I'm going to just kind of show. As a matter of fact, let me do big screen here. Let me do it like this. I'm just going to show you guys some questions, and we're going to go through it together. I'm going to give you guys a few seconds to tell me the answer. Tell me what you think the answer is, and then I will reveal the correct answer, okay? All right, let's go. So, one thing I do want to mention here. So for those of you that don't know, my study guide is broken down into 12 modules, okay? So let me just show you guys really quickly. You have the introduction section here, and then there's module 1, foundational medical assistant, and then we have medical law and ethics, medical terminology and anatomy, infection control, patient intake and vital signs, patient care is module 6, module 7 is testing and laboratory testing, module 8 is phlebotomy, module 9 is EKG, module 10 is patient education and coaching, module 11 is administrative medical assistant, and then module 12 is CPR and medical emergencies, okay? And then there are 3 practice tests at the end. After each lesson here, there is a quiz with 25 questions, okay? So for those of you that's wondering, it is an online study guide. People are asking me if I have a PDF version. No, there's no physical version. It is just all digital, okay? What is the first thing you do if you suspect an opioid overdose? What's the first thing you do if you suspect an opioid overdose? Are you going to administer Narcan, call 911, get an AED, or administer CPR? If you suspect that a person has overdosed on an opioid, what's the first thing you're going to do? I'll give you guys a few seconds to put the answer in here. Let me look at Instagram. Oh, I didn't realize I still had that banner down here showing. What are you going to do? Someone says call 911. Someone says A. Let's see. What do you guys think? What do you guys think? Any other guests? I see one person says call 911. Someone says Narcan. A few of you saying Narcan. A. Okay, so let's go with A. I see more A than anything. Let's go with A. So if you do have it, all you do when you're taking these practice tests and quizzes on my refresher course, you just simply choose the answer you want and hit check. And it'll let you know if you got it correct or not. Okay. So the first thing you're going to do is call 911. Okay. Now, Narcan, you will administer Narcan for overdoses like fentanyl, right? But the first thing you want to do is then call 911. All right, next question. Manifestations of heat exhaustion include all of the following except what? Heat exhaustion includes the following except what? Cool, clammy skin, hot, damp skin, a weak, fast pulse, or fainting. All of the following except what? Guys, I need to figure out how to go live on TikTok when I go live on YouTube and Facebook. That is like my ultimate goal. If they can figure out a way that I can be live on TikTok right now at the same time that I'm live on YouTube and Facebook and Instagram, that would be perfect. I know there's ways to do like TikTok and other places, but I need TikTok as well as YouTube and Instagram at the same time. If I could do that, that's one of my big 2025 goals, to be able to do TikTok as well. Okay, I see a bunch of you guys said A, so let's go with A. Let's see. So you're going to choose the answer you want and hit check. So it's going to be actually hot, damp skin. So heat exhaustion is a little bit different. So you're instead of the skin feeling hot with heat exhaustion, in this case, the person is actually going to feel cool. Okay. The person is actually going to feel cool with heat exhaustion. Okay. Now heat stroke, they'll feel hot. I'm sorry. Well, yeah, with heat stroke, they'll feel hot. But with heat exhaustion, they'll actually feel cool. All righty. Next question. Treatment for hypothermia and frostbite includes the following. Select all that apply. And you guys don't have to choose all of them in one comment. Just put some of them that would be included with hypothermia and frostbite. Treatment. Would you warm the area? Would you move them to a warm place? Run under hot water? Layer the body with blankets, or stay close to hot surfaces? What is some of the treatment options for hypothermia and frostbite? While you guys are doing that, another thing I want to address too, a lot of people often ask me, does my study guide, does my videos help with a certain certification? I want to remind you guys that each certification, they ask the same type of questions. Okay, they all ask about vital signs, EKG, order of jaw, administrative questions, the CPR first aid questions, like you guys are seeing on my study guide. They all ask the same type of questions. So my video, yes, they help with all my YouTube videos help with all of the certifications, and my study guide does as well. Okay. Another question I get is your videos and is your study guide up to date with the changes? The updated tests that the NHA did last year, they didn't change anything. All they did was update some things and add some things. Okay. And that test could be 20 years old and it's still going to be the same content on the test, y'all. So don't worry about thinking that that the videos don't apply anymore, or you need some type of new study material. All they do is they just add information. Okay, so I just want to remind you guys about that too. All right, so let's see. I see A on here. We got B. What else y'all saying? C, D. Okay, nobody chose the last one. So I'm going to go with these options right here. Let's see what we got here. Okay, so we're not going to run under hot water. If anything, we're going to warm the area, move them to a warm place, and then layer the body with blankets for hypothermia and frostbite. Okay. All right, Let's go to the next one. Hopefully this is helping you guys. Let me know in the comment, guys, if this is helping you right now. Let me know in the comment if this is helping you. Which degree of burns manifests with red, painful blisters? First degree, second degree, third degree, or fourth degree? And yes, there is a fourth degree now. Many people don't know that there is a fourth degree burn now that goes deeper than third degree. So you guys know third degree involves all of the layers of the skin, right? Fourth degree is when it goes into even some nerve damage as well. Okay, so yes, there is a such thing as a fourth degree burn now. Wait, what was the answer? I'm sorry, Kimberly. I'm just seeing your comment. Hey, beautifully, Brina. Is that my old student, Sabrina? Is that you, Sabrina, or no? I can't really see that picture too well. The answer before this one. Which question, Kimberly? Remind me which question, because I can't remember. I don't know which one you're referring to. Let me know which question you're referring to. So let's see. Let's see what you guys are saying on Instagram. And somebody on Instagram says the one that you select more than one. Oh, for the frostbite, it was I'll go back to it in a second. I'll go back in a second after we answer this one. First degree. You guys saying first degree? Somebody said third degree on Instagram. I see more first degrees on YouTube. So let's see. Oopsie. Sorry, I didn't mean to scroll back up. Okay, so this one is going to be second degree. So first degree is like it's just the first layer of skin. So the first degree is just going to be like, let's just say you know how you cooking sometimes and you might touch the pot on accident, or well, touching a pot can result in a second degree burn. But I mean, like, just a burn where it's just like, oh shoot, you just kind of just touch the outer layer. That's more of the first degree. Okay, second degree can result in red, painful blisters. Okay, let me go back to this really quickly. Somebody wanted to see this. So all of the answers for the treatment for hypothermia and frostbite was warm in the area, move into a warm place, and layer the body with blankets. So for that person that asked on Instagram, hopefully you can see this. So it was A, B, and D. Okay, those were the correct answers. All right. Which degree of burns often has less pain? Select all that apply. First, second, third, or fourth. This might be a little tricky. Which degree of burns often has less pain? It's a little tricky. You're welcome, Kimberly. Anna says, I have to come back. I can't hear. You guys can hear me, right? Just confirm, you guys, confirm in the comments that you guys can hear me. I just want to make sure that you guys can actually hear me. Because I don't know if that's just her or if my sound. Okay, you said you can hear. Okay, thank you guys. Hey, Christina on Facebook. Zeal says I passed. Oh, congratulations, Zeal. Congratulations. Awesome. You're building your resume from the video. Awesome. Awesome. So good to hear. Someone said they're watching from Texas. Okay, Texas. Texas is on one of my list of possible relocation states. I don't know what part of Texas, but I have a few on my list of possible places to relocate, guys. I'm within the next year or so, I'm planning to I need to move somewhere warmer. I'm in DC right now, and y'all know I'm tired of the cold weather. All righty, let's see what we got here. Let's see what you guys put. So some people put first and fourth. Okay, so we're gonna say first. What else y'all put? Y'all put 3 and 4. Okay, no, I don't see that anybody put second degree. Let me see what Instagram is saying. Okay, I don't see. Okay, all right, so let's see. I see you guys say first, second, third, and fourth. Let's check it. So guys, surprisingly, the answer is actually third and fourth degrees. And this is because of the nerve damage a lot of times the feeling can be gone. So initially it can be less painful. So that's why I said it may be a little tricky for you guys, because you may think, okay, first degree, that's just a minor burn. But you guys know, like I mentioned that example of touching your hand on a pot, y'all know that hurt when you touch that heat, right? But when third degree, when you if you have a third and fourth degree and you have nerve damage, it can actually be less painful. And hint, hint, that is a test question. Well, these are all possible test questions. But yeah, that is something you need to know. All right. Which combination of symptoms or manifestations is true of diabetic shock? A person may feel numbness, paleness, tingling and redness, shivering and confusion, numbness and weakness in face and arms, slurred speech, loss of vision, loss of balance, a rapid heart rate, fainting, seizures, coma, and can lead to death, or chest pain, heaviness, arm pain, shortness of breath, fatigue, and nausea. Which combination is a symptom or manifestation of diabetic shock? Anna said that's why me and my sister moved to Atlanta. Actually, Atlanta is on my list too. Texas. I don't have a necessary city. Well, I have a couple of them, maybe Houston, Dallas. I don't know. But as far as cities, Atlanta is definitely on my list as well, Anna. That's funny you said that. I know it gets cold down there too, but it's not like up here. I am really sick and tired of the cold. And I want to move somewhere that's more cost effective as well. If anybody is on here, you're in the DMV area or up north, period, y'all know how expensive it is up here. I am trying to move somewhere where I can actually get some land. Like here in DC, the cost of housing here, the homes in DC are like, I'll give you guys an example. A friend of mine lives in what was it? Was it Kentucky? Was it Kentucky? No, it was Indiana. Her house was like $200,000. And when she showed me a picture of her house, I showed her a picture of a very similar house here in this area that was like $600,000. Okay. So just imagine the same house in Indiana that was $200,000 cost like 600 or more here in DC. Not to mention the houses like in the downtown area, like going uptown and stuff that are like $1 million, and you don't even have a yard, a front yard and backyard. So yeah, it's ridiculous up here. All right, I'm getting off topic. Let me get back to this. Sorry, guys. Okay, let's see. Y'all are saying A. Okay, so for diabetic shock, this is going to be rapid heart rate, fainting, seizures, coma, and it can lead to death. Okay, so for diabetic shock, it can be rapid rapid heart rate, fainting, seizures, coma, and can lead to death. Okay, let's see. What is the ratio of compressions to breaths when performing CPR on an adult? Melody says in Louisiana down south, we never get snow. We're about to get 6 inches. Wow, Melody. Wow. That's funny because I have seen places that have been getting snow that don't normally get snow. That is something else. Wow. She said we never get snow. And you know what, Melody? I wouldn't even mind it every now and then. Like I wouldn't mind the cold every now and then, or it being red to get snow. I'm just tired of it always being cold. Like it's colder here longer than it's warm. So we get about 3 months of warm weather, and the rest of it is just cold. All right, let's see. I see some mixed answers. I'm seeing A, I see D, I see C. Tanya says we're about to get snow tomorrow. Where are you located again, Tanya? Remind me where you are again. Let me see what Instagram is saying. Oh, its name Marie says no, Louisiana don't get snow. Yeah, see, I need to be somewhere like that. C Bree says I wanted to let you know I passed my CCMA. Congratulations on the first try. Congratulations. C Breeze, do me a favor. Can you send me an email review? She said your program helped me a lot. I'm guessing you're saying that you have my refresher course. Can you do me a favor and send me a review? For those of you that have my refresher course, please send me a review. If you can include your picture or do a quick video, that's even better. But send me, email me a review. All right, let's see. I'm seeing mostly A. So we're going to go with A. Let me look back at these comments again. Yeah, I'm seeing A more than anything. So let's go with A. Oh, wait a minute. Am I? Yes. Oh, wait a minute. I see A. Yeah, I see mostly A. Or was that for the last question? Someone says C. Let me look at Instagram. Let me see what C is saying. Okay, mostly A. We're going to go with A. Okay, so it's 30-2. Now, 15-2 for a child is true. 15-2 for a child with 2 rescuers. 15-2 for a child with 2 rescuers. This is true, but no, it's going to be 30 compressions to 2 breaths. Okay, make sure y'all know that, not just for the test, but in case you got to actually do CPR. I do see one person said it was C. Okay, make sure you know that. All right, how should a sprain be treated? With a warm pack and avoid elevation, a warm pack, sterile dressing and elevation, a ice cold pack, sterile dressing and elevation, or ice cold pack, a bandage, brace and elevation. How should a sprain be treated? Okay, I'm seeing mostly D coming up. You guys got it. Y'all got it. Ice or cold pack, bandage or brace and elevation. Now later, to help with the pain, you may apply, something warm to, to help with the pain and to keep it comfortable. But initially you want to use an ice pack or cold pack. Okay. Which of the following is appropriate for minor burns? Apply a warm, wet cloth. Apply a cool, wet cloth. Run it under warm water or run it under hot water for minor burns. And it says because of Miss Kate, I passed energy on my first try, had her playing on repeat. And, that is too funny. Okay, I'm seeing B. Let's see, anybody else? All right, let's go with, okay, yep, I see B. I see B mostly popping up. Let's see. Yep, so for minor burns, a cool, wet cloth. Yep. We don't want to run it under warm or hot water. Obviously, it's a burn. We want to cool it. All right, which of the following is a manifestation of syncope? Paleness, fainting, loss of consciousness, uncontrollable muscle spasms, can't speak or cough, and grabbing at the throat. The heart stops suddenly, which stops blood flow to the brain and other vital organs. Syncope. All right, I'm seeing A. All right, let's go back. Yep, y'all are on it. One thing too, I always mention, remember, I always tell you guys, when you are studying for certification, make sure you know the wrong answers. You guys know I always say that. So make sure you know what these indicate too. So let's go through each one of these quickly. What would this be a manifestation of? Uncontrollable muscle spasms. Okay, this is an example of how you study. Because every time you go through a question, you want to make sure you know what the others mean. What would this be a manifestation of? Uncontrollable muscle spasms. What is that? What would that indicate? Yep, seizure. Okay, what about can't speak or cough, grabbing at the throat? What is that a manifestation of? You can't speak or cough. They can't speak or cough, and a person is grabbing their throat. Okay, choking. Yep. And then the heart stops suddenly, which stops blood flow to the brain and other vital organs. What would that be a manifestation of? The heart stops suddenly, which stops blood flow to the brain and other vital organs. That will be what? What would this be? Let me look on these comments, see if anybody on Facebook is commenting as well. Someone says myocardial infarction. So, okay, cardiac arrest. That's what I was looking for. This is cardiac arrest. So myocardial infarction, which is heart attack, yes, it can lead to cardiac arrest if it goes untreated, right? However, this is referring to a heart attack when the heart stops. And I'm glad y'all said that because it reminded me that a lot of people get myocardial infarction, heart attack, and cardiac arrest mixed up. But I want to make sure you guys know. I love the way somebody put it before. They said, look at a heart attack as a plumbing problem and and cardiac arrest as an electrical problem. Okay, so with a heart attack, there's the blood flow has stopped going to the heart and parts of the heart gets damaged. Okay, um, with and with cardiac arrest, the heart has actually stopped. Okay, there's no activity going on at all. Okay, which can actually stop blood flow to the brain as well. Okay. All right, for which of the following emergencies would it be appropriate to call 911 immediately? Syncope, a sprain, a fourth-degree burn, or an insect bite? Which of the following emergencies would it be appropriate to call 911 immediately? Okay, I'm just looking to see. I'm seeing different answers. I'm seeing C. Okay, looks like I'm seeing. Okay, I'm seeing mostly C. So let's go with C. All right. C is the correct answer, fourth-degree burn. So syncope, sprain, and insect bite. Now, we know there are certain instances where we may have to call 911 for these type of emergencies, but what do we know we absolutely need to call 911 for? Fourth-degree burn, absolutely, because it affects all layers of the skin as well as underlying tissues as well as the nerves. Okay. Next one. Which phase of wound healing begins at about day 21? Hemostasis, inflammatory, proliferation, or maturation? The phase of wound healing that begins at about day 21. And guys, I'm just going to do just a few more. I'm not going to go through the entire quiz. We're just going to do a few more. And I'm going to let you guys go. I just wanted to hop on here to just kind of remind you guys that it is $9.99 for 30-day access until tonight at 11:59 p.m. Now, again, the sale is just for 30-day access. This is for people that's just like, listen, I'm about to take my test within the next month, and I just need something for 30 days. Okay, it's $9.99 until tonight, 11:59 p.m. tonight. 3-month access is $27 and 6-month access is $80. And as I mentioned, there are payment plans available. There is like Afterpay and PayPal Pay and stuff like that that you can do. All right, I'm seeing mostly D. So let's see. Yep, the maturation phase. Yep. Good job. You guys are doing good. Which phase of wound healing begins at about day 3 and is typically the most painful? Hemostasis, inflammatory, proliferation, or maturation? Now, one of them obviously we can rule out because we just saw that maturation was day 21, right? So which of these three would be day 3 and typically the most painful phase? What do you guys think? I'm seeing people saying B. Okay, I'm seeing mostly B pop up. Okay. Yep, I'm seeing all B's. Okay. Yeah, I got it. You got it. Y'all are on it. A patient who is experiencing lightheadedness, dilated pupils, pale skin, low blood pressure, and a rapid pulse may be experiencing early signs of which emergency? Shock, seizure, hypothermia, or syncope? Lightheadedness, dilated pupils, pale skin, low blood pressure, and a rapid pulse. They got a lot going on. Shock, seizure, hypothermia, or syncope? Okay, let's see. I'm seeing A. I see mostly A. I see one person said D. All right, let's go with A. I'm seeing mostly A. Let's go with A. Yep, y'all got it. You got it. Now, seizure, we saw that one, uncontrollable spasms, right? We did see that one already. So you can kind of rule that one out. And syncope, which was fainting, right? And then hypothermia, I don't think we talked about that one. It was mentioned in the thing, but the person is cold and um may even have numbness. Their fingers, toes, affected area may be even blue. All right. What is the first step when treating a patient with profuse bleeding? Elevate the wounded body part, determine if the bleeding is coming from a vein or artery, apply pressure, or rot with a sterile dressing. And this will be the last one we go through, guys. This will be the last one. What is the first step when treating a patient with profuse bleeding? Okay, I'm seeing mostly C. Let's see. Okay, yep, we want to apply pressure. We want to apply pressure. Now, guys, this is going to be it, but I do want to show you guys something really quickly. Let me show you this. When you guys do my refresher course and you finish it, you do get a certificate. This is an example of how the certificate looks. So once you complete it, you get a certificate of completion. And it'll say, it was awarded to, this is an example of one, for successfully completing the clinical medical assistant refresher course, and it's signed by me. It's a real certificate. So you do get that. So guys, just wanted to remind you all again that it is $9.99 until tonight. All right, y'all. Let me know if y'all have any questions. Let me know if you have any questions. Put them in the comment section. I'll try to answer a few before I get off here. Hey, Soraya. Let me know if you have any questions. Okay. If anybody wants to call in and ask a question, I'll leave that link too. Let me see. Call in link. Let me leave that right here. Call in link. I'm going to leave that in the comments. I'll leave that there. Let me put it on Instagram too. You don't have to come on camera, but I'll just put that here, the call in link. If you want to call in and ask a question, if you have a question, you can put it on You can put it on, you can put it in the comments. Nakia says, thank you. I plan on purchasing a refresher course. I take my CMA next. Awesome. Listen, I understand being stressed out. It is perfectly normal to be nervous. I want to tell you guys, it is normal to be nervous. It is okay. Just still take your test though. It's okay. Somebody said my exam is in 2 days, Xavier. Hey, Xavier. Oh, listen, Xavier, I think you are ready because I've been seeing your answers that you've been putting in the chat and they've been pretty much all right. So you are so ready. Which test are you taking, Xavier? Someone says, you know, of anyone that's hiring in Canada. I don't. I have no idea. You just have to search for jobs in your area. So let me know, guys, if you have a question, you can use the call-in link or you can put it in the chat. Okay, I see Alondra has a question. Oh, you got to unmute yourself, Alondra.
That's too much time or not enough?
Oh, Alondra?
Yes.
Hey.
Hi.
Can you guys confirm for me in the comments that you can hear Alondra as well? I can hear her, but I want to make sure she's heard in the comments as well. Let me know that you can hear. Okay, go ahead, Alondra. What's your question? I'm sorry.
No, it's okay. I was just going to say, like, I'm taking my exam, the NHA CCMA exam, in the end of February. I don't know if I'm giving myself too much time, and I'm scared I'm not going to retain all the information. I'm going through Stepful as a program. I don't know if you think I should take less time or I should, if it's fine.
Yeah, no, I think it's fine. You said the end of February. No, I don't think it's too much time. I think you actually, you have more than enough time. Because I definitely wouldn't want you to cram. Now, if you had said you're not taking it until months down the line, then I would be like, okay, yeah. But no, I think that's good time. I think you should just take time now. Are you done with school already?
Thursday's my last day.
Thursday's your last. Okay, perfect. So then you have about a month. That's actually about a month to study. And I would just go through each. If you have the study, I don't know if you have my refresher course, if you have the NHA study guide, but I would just go through each module, take like a couple days and go through each module and start with your weak areas for so whatever area you struggle with. So let's just say like it's EKG, right? Just go to that part of the study guide and focus on studying that. And then also, Alondra, make sure you download the test plan for the test you're taking and use that as a checklist as well. Okay. And
I'm sorry.
Yeah.
Do you know how I like download the test plan? Is it through NHA?
Yeah, you just literally just Google. So you can go to NHA website and do it. But if you just Google, if you go to Google right now and do CCMA test plan, download CCMA test plan, it'll come up. And you just download it. And I recommend using it as a checklist. So everything that you know on it, just highlight it and check it off that you know it. And anything you don't know, you go back to your study guide. So you actually have an advantage because you got a whole month to do this. And your goal is to check everything off on a checklist. I recommend this to everybody because the test plan tells you everything you need to know. So if you can check everything off, you're good. You don't have anything to worry about. You're going to pass the test.
Thank you. Oh, and I had another question. Man, it kind of went over my head now.
Oh, you forgot. Oh, well, if you remember, just let me know.
Okay. Thank you very much.
You're welcome. Anybody else, let me know. Hi, Pooja. Pooja says I can't hear. You might have to go out and come back in, Pooja. Everybody said they can hear. If anybody else has a question, let me know. I put the call-in link in the chat. You just click on the link and you can ask your question, or you can just type it in the chat. Let me see. I will definitely be retested, missed it by 2 points. Okay, so I do see this a lot. So anybody that got super close, I know, when this happens, I know it sucks because it's like, oh, wow, I was just right there. But I'm going to tell you guys, when you get that close, I want you to still pat yourself on the back because that means that you know the information. You just maybe needed more time, right? Or maybe, for whatever reason, you missed a couple of questions, a few questions, but you know enough to pass it. So for anybody who maybe have gotten close and you're about to test again, look at as I mentioned this on the last video I did, look at your score report, your detailed score report, and look at the areas where you fell short. It's going to show you where you got below the passing standard, and you want to really double down on those areas. Okay. If time was an issue, because sometimes people, they run out of time. If that was an issue, and then make sure when you guys are taking your test that you flag all of your hard questions. You flag or bookmark your hard questions, okay? And come back to them at the end. Okay. Somebody said I should be doing this on a regular basis. Yeah, I used to, Carl. I just don't have as much time these days, and I haven't had time to create anything. So I said, let me just use the study guide as a, study session as a preview. So for those of you that's thinking about getting it and you saw, the questions, you want to do some more, definitely get it while it's only $9.99. And then of course, it's still affordable even after the sale. But I just want to make sure you guys know that you can get it at least for 30 days for $9.99. Let's see. Congratulations, Natalia. She took the Ironman pass. How do you prep on test day for the NHA census online? So are you on test day? Are you saying if you're taking it online? So for those of you you mean you're taking it online from home, Renee, you're taking it remotely. If that's the case, make sure you don't have any distractions around you. So many people have had their tests stopped because of anything going on around you, noise in the background. If somebody walks past in your background, we had students at our school taking it remotely and had to stop because I walked in or my coordinator walked in, and literally it was his office and he just walked in going to his computer and they shut it off. So you got to make sure you don't have anything going on if you're taking it remotely. I personally don't recommend remote testing unless you absolutely have no choice. But if you do have to do remote testing because of the weather, you can't get out for whatever reason, then make sure it is it's a lot. It's a lot. Just make sure your background is completely silent. Take my test on Friday. Nervous, but studying. Yes. Make sure you're studying. It's normal to be nervous. Do you have an emergency room Epic refresher? No, I don't. Epic, just look on YouTube. Look up Epic videos on YouTube. Epic tutorials. So for anybody, I seen this question asked in my Facebook group as well about Epic. Just look up Epic tutorials on YouTube. That's all. They have videos on there. Let me look on Instagram, see if there's any questions. Oh, Seabreeze, I'm sorry. Yes. So my email, you can send it to khartcpr. I'll put it in the chat. khartcpr@gmail.com. So you can email me there. So anybody who has a review for me, if you did my refresher course and it's been helpful, you passed your test, please make sure you send me a review. If you can send me a quick video review where you're just on the video and you're like letting me know how much it helped you, that's even better for me. Or if you can send me a written review with a picture. These reviews I'm just going to be using when I'm marketing the course, because I'm going to really start putting this course out there. I really don't post it a lot, but I do want to start doing like video marketing and stuff like that to try to get it out there more. So if it's been helpful to you guys, you don't mind me using your review on my marketing tools, a video or a picture, please send it to me. I just put it in the chat, khartcpr@gmail.com. Hi, Miss K. I'm looking on Instagram now. I've been watching CCMA videos. I started early so I can be prepared in May. I take my May 5th. Oh, yeah, you real early. You are real early. Seabreeze, I'm having trouble signing into is there anything? Yeah. Email me, Seabreeze. Email me because I'm gonna need your email and stuff. Yeah, just email me at the same email that I gave you for the review. Just send me email me there and let me know, so that way, because I have to look you up by your email and I can send you the link. If you're having trouble signing in, I'll send you the link. And I know you said you passed already. But you still should be able to get in even if your access expired. So either way, still email me. And I just want to remind you guys that the access, the $9.99 is for 30-day access. So if you do get it, make sure you get in there and go through it. Don't wait until the last minute and then your access expires. The 3-month access is $27, and then the 6 months is $80. But Make sure you guys get in there and really go through it so your access doesn't expire. Let's see. All right, I don't see any more questions, guys. Let me know if you guys have nothing else. I'm going to go ahead and go. I know somebody said I should do this more often. I need to figure something out because I just don't have the time to do it like I would like to, like I used to. But oh, I want to tell you guys something, and let me know what y'all think about this. I'm telling y'all this so that way I can put it out there in the atmosphere. And I'm telling you guys this because I want to hold myself accountable. But what do you guys think about this? I've been thinking about doing a recruiting agency for medical assistants because I get a lot of you guys that's looking for jobs and stuff like that. And I'm really kind of thinking about starting a medical assistant recruiting agency. What do you guys think about that? Let me know. A medical assistant recruiting agency. Seabree says I can't hear you. You can't hear me anymore? Let me know if you can hear me now, Seabreeze. Seabree said they can't hear me anymore. Let me know what you guys think about that. I'm thinking about starting a recruiting agency. All right, guys, I'm going to go ahead and get off here. I don't see any more questions. And Seabree said they can't hear me. I don't know if my sound has gone out. Let me see. Let me go back to these comments. And for some reason, I'm not able to see any comments anymore. I don't know what's going on. All right, guys. I don't know what's okay. I see comments coming up now. The kids said that would be dope. Honestly, that would be awesome. Yeah, I'm really thinking about doing that this year, guys. So I'll keep y'all posted on that. But let me go ahead and end this because I don't know. My sound obviously went out on Instagram, and then for some reason the comments are not coming up. But Xavier, good luck. Let me know when you pass. I think you said what yours is in a couple of days. Let me know when you pass. Lydia said hers is on Friday. For everybody that's taking your test, good luck. And let me know when you pass. Of course, just leave it in the comments, email me or whatever. For those of you that just recently passed, congratulations. For those of you that's considering getting my study guide, it's at marefreshercourse.com. You guys have a great day. Talita said, great idea. Christina says, that would be amazing. Oh, good luck to you as well, Angela. I love you too, Soraya. Good night. And let me know how things are going, Soraya. All right, guys. Let me go ahead and end Instagram. Nikki said, when are you going to go live again? I'm not sure, Nikki, but make sure you're following me on YouTube and your notifications are on. So YouTube, I'm at the same name as on Instagram, Medical Assistant with Miss K. Make sure you have your notifications turned on because it'll notify you when I'm live or when I'm scheduled to go live. But I'm not sure because I don't want to give you guys a day and then something changes. But I'm going to try. I will say this though, Nikki, I'm going to try to go live more this month. I'm going to try to go live at least a few more times. Now, I don't know if I'll be doing study session like I did today, but I do plan to go live more because I know I haven't been really doing much on that channel lately, but I do plan to go live more. At least on YouTube anyway. Because on YouTube, I can just simply go live from my phone. But with Instagram and Facebook, I got to be on my computer to do all three at the same time. But with YouTube, it's easy for me to just simply go live on my phone. All right, guys, let me go ahead and end Instagram first. And then let me end Facebook and YouTube. It's definitely a great idea. Sorry. Thank you, Angela. All right, guys, y'all have a blessed day.